Hey there, if you're an expectant parent, you know that pregnancy can feel like a crash course in medical terms, right? Well, today we're going to demystify one you might hear about, the Obstetric Doppler scan. We're going to break down what it is, why your doctor might mention it, and really what it means for you and your baby. So let's get right into it. Okay, so picture this. You're at your appointment and the doctor says, I think we should do a Doppler scan. Your mind might start racing a little, right? Any extra test can sound kind of scary, but I promise you by the end of this, you'll see it's not something to be afraid of. Actually, it's an amazing tool that helps make sure your baby is getting the best care possible. So what is it exactly? Well, at its heart, a Doppler is just a special kind of ultrasound. But here's the cool part. It doesn't just show you a picture of your baby. It gives doctors a window into how your baby is actually doing inside. And it does that by looking at something absolutely critical, blood flow. The concept is actually pretty simple when you think about it. Imagine the placenta and umbilical cord are your baby's lifeline, right? They're the supply lines. A Doppler scan is basically a checkup on those supply lines. It makes sure that all the good stuff, oxygen, nutrients, is flowing through nice and steady. It's like getting a direct look at your baby's entire support system while it's up and running. Now, it's really important to know this isn't a scan that everybody gets. It's not part of the standard routine checkups for every single pregnancy. Think of it more as a specialized tool that doctors use when they want to look a little closer at something, maybe because they're keeping an eye on a specific condition and just want to be extra careful. So, what are some of those reasons? Well, it could be if there are concerns that the baby isn't growing quite as expected, that's called fetal growth restriction. Or maybe if the mom has high blood pressure. It's also super common for multiples, twins or triplets, or if there's been a change in the baby's movements. But here's the bottom line for all of these situations. The scan gives doctors the information they need to make the safest and best decisions at the right time. So you might be wondering, how can just checking blood flow tell doctors so much? Well, the scan zeroes in on some very specific blood vessels. It's like checking the traffic on the main highways of your baby's support system. By seeing how smoothly things are moving on those roadways, they get a really clear picture of how your baby is thriving. And they look at a few key spots. For example, they'll check the umbilical artery. That's the main highway bringing supplies to your baby. Then there's the middle cerebral artery, which is fascinating. It shows if the baby is cleverly sending more blood to protect its brain if supplies are a bit low. And they'll also look at the uterine arteries to see how well blood is flowing from you to the placenta to begin with. See, each measurement is another piece of the puzzle. Okay, so what's the appointment itself actually like? I think knowing what to expect really helps take away any anxiety, so let's just walk through it. It's super simple and straightforward. Honestly, the whole thing will probably feel very familiar. It's just a regular, non-invasive ultrasound on your belly, exactly like the others you've likely had, and it's fast. We're talking maybe 15 to 30 minutes tops. They analyze everything right then and there, so you leave with one of two things, either total reassurance that everything looks great, or a really clear plan for what comes next. Boom. No guesswork, just answers. Okay, let's stop for a second and talk about the big question, the one that's probably on your mind right now because it's on every parent's mind when they hear about something new. And the answer is a big, definite yes. It is absolutely safe. A Doppler uses the exact same ultrasound technology as a regular scan. It's totally non-invasive, and it's considered completely safe for both mom and baby. Period. You might also hear your doctor talk about a growth scan, and it's easy to get them mixed up. So here's the difference in a nutshell. A growth scan measures size, how big your baby is. A Doppler scan measures supply, how well your baby is being supported. They're asking two different but super important questions, and that's exactly why they're often done at the very same appointment, to get that full 360-degree picture of your baby's health. All right, so we've talked about why you'd get one, what it measures, and what the appointment is like. Now for the part that really matters. What do the results actually mean for you and your pregnancy? When it comes down to it, the results really only lead to one of two outcomes. And honestly, they're both positive. Most of the time, and I mean the vast majority of the time, the scan just gives you wonderful peace of mind. It confirms everything is flowing just the way it should be. But in those few cases where it does spot an issue, it gives you something that's just as valuable, a clear, concrete plan of action. So let's not shy away from the what if. What if the Doppler does show that the blood flow isn't perfect? What happens then? Well, this is actually where this scan proves just how incredible it is. If they do find a concern, it's not a time to panic, it's a time to plan. Your medical team takes that information and builds a strategy. Maybe that means more frequent monitoring, just to keep a closer eye on things. Or it might give them the data they need to decide on the safest, best time for your baby to be born. The point is, this scan lets them act early and with total confidence. And that's because, at the end of the day, this isn't just about cold, hard data. It's about care. There's a quote I love that I think says it all. We monitor more than just numbers. We monitor what they mean for your baby's safety. It's all about turning those measurements on a screen into real-world safety for your little one. So let's end on this thought. An obstetric Doppler scan is so much more than just another medical test. It's really a tool that gives us a glimpse into the future. It provides this incredibly clear picture that lets your doctors protect your baby's health by giving you either total peace of mind or a clear, proactive plan. And when you're pregnant, having that kind of clarity, well, that's pretty much everything.